Welcome to Champions of Care, brought to you by Oakwood Healthcare. Today, we're talking about diabetes. If you have diabetes, you'll want to listen in to what our experts say about maintaining good health and a high quality of life with diabetes. If you don't have diabetes, you're going to want to listen too, so you can hear what you can do right now to make sure you don't get diabetes. With me in the studio is an endocrinologist who practices in Dearborn, Michigan. Please join me in welcoming Dr. Opata Alzohaili. Welcome.
Thank you very much. Thank you for having me.
Doctor.
Thank you for saying the name right.
You're very welcome. Please explain as basically and simply as you can, what is diabetes?
It's a good start question. Diabetes, there's several kinds of diabetes. The common ones that we know, type 1 and type 2. Type 1 occurs in children, young patients. That's an autoimmune disease. Antibodies attack the beta cells in the pancreas, stop it from making insulin. When you stop making insulin, you have to replace it with insulin or beta cell transplant or pancreatic transplant or insulin pump. So that's an autoimmune disease. We don't know the exact etiology, but we know there's an increase of autoimmune disease. Our immune system makes mistakes by attacking the thyroid, the eyes, the joints, and causes different diseases. There's some familial incidence of this, but what happened, we don't know if it's virus or chemical or exposure to make the immune system make mistake. That's type 1. Nothing you can do to prevent it. There's different trials of it trying to prevent it, didn't work. Type 2 diabetes is the most common. 90% of diabetes is type 2. This is when we see patients who are obese, who have family history of diabetes. Most of the etiology of type 2 diabetes is familial. If your father or mother or uncle or grandfather have diabetes, your risk of type 2 diabetes increases 4 times with every member in the family of diabetes. The bigger you get, the more diabetes you will have. And the etiology here is more of insulin resistant. Your pancreas make insulin, but not enough. The problem in type 2 diabetes, that the reason we can't control it because it's a multi-organ disease. Your liver produces a lot of sugar overnight. Your muscles cannot handle sugar very well. Your kidney cannot handle sugar very well. Your brain doesn't tell you when to stop eating. You're hungry all the time. Your belly fat, what they call the central fat, produce cytokines that make you insulin resistant and cause diabetes. So there's several multi-organ failure. That's why you can fix the pancreas, but you can't fix type 2 diabetes because it's a problem almost in every single organ in your body involved in type 2 diabetes.
So you've explained type 1 is more hereditary, and we tend to see that in children. But that type 2, can we do things to prevent it in the first place?
Yes, just correction, type 1 is not. We see it in children, it's autoimmune, but it's not familial. It's type 2 is actually the familial.
Okay.
The risk factor comes, so knowing that you can prevent type 2, unfortunately type 1, nothing you can do to prevent it. If you have a family member with type 1, your risk may increase just slightly, but nothing again you can do to prevent type 1 because it's an autoimmune mistake by the immune system. Unless genetic therapy improves the next 10, 15 years that we can go to the gene and the antibody that attack beta cell and stop it, really nothing we can do. But for type 2, it can't be prevented. You know that you are at risk of type 2 diabetes by first ask your family. If you have family member with diabetes, you are at risk. Second thing, look at your belly. If your belly extending out, you are at risk of type 2 diabetes. If you look at your neck and you see darker skin called acanthosis nigricans, or if your child have that, or if your child have a little belly start hanging out, that's the biggest risk of type 2 diabetes. Obesity, lack of exercise, and poor eating habits are the main risk factors for type 2 diabetes. So you can have family history, but that doesn't mean you will get it. If you behave, if you exercise, if you eat right, eat all the right stuff, you could prevent diabetes from happening all your life. But if you don't, you will get it.
Doctor, why, in your opinion, are we seeing such an increase in diabetes in the last 10 to 20, 30 years?
We see where obesity increased. All the state has the highest obesity are the one that has the highest type 2 diabetes. We look at our children now, or we compare how we used to eat now with our activity. We are less active now than we do before. Our activity when we were young is mostly outside, exercise, running, doing different kind of sports. Most activity with children now is sitting at home playing different games. So the amount of activity we do are much less, And the type of food, not only the amount of food, about super size it, but also the type of food we eat now is full of different fortified and enriched food that is full of, for my opinion, full of toxins for the body. So these toxins eventually get from generation to generation. All these toxins for children are the one causing the obesity. And if you look at just obesity in children now, in Michigan, we probably around 55% obesity. You're talking 50% of these kids will end up diabetic very soon. Now we have type 2 diabetes in 7, 8 years old kids. We never heard of this before. It used to be you don't get type 2 till you're 30. But now we see it in 7 and 8. 25% of type 2 diabetes in, 25% of diabetes in children now is type 2 because of obesity. I think that's the main risk factor. We're not active and our eating habits are horrible.
I have heard you mention exercise, fitness, movement a number of times. Can you please explain what is the connection between diabetes and fitness? Now, you told me it's not good to be heavy and overweight, so I get it that if I'm active and thin, but sometimes people with diabetes can better manage their disease with exercise. I just don't understand the connection between exercise and diabetes.
It's very complex relation. With type 1 diabetes, we talked about the pancreas not making enough insulin. Exercise may help control it, but doesn't really do much. It is the type 2 that exercise will help. And we have two kinds of exercise. We have aerobic exercise that you run and you do whatever you want to do at home. Aerobic exercise help you lose weight, get rid of some of the fat. But we're realizing more and more now that weightlifting, muscle building, I mean, not muscle building to be an alliance player, but muscle building to a way increasing the muscle mass. You can increase the muscle mass in any muscle in your body, any form of exercise. It will increase the muscle mass. The muscles need insulin to bring the sugar into the muscle to be burned and used. If we're not active and our muscle mass is getting smaller and smaller, these muscles don't use sugar that much. Then the insulin has to be produced at a much higher rate to kill that sugar, to burn that sugar. So exercise, if you add the aerobic to help decrease the fat mass in your body, and weightlifting and muscle building to increase the muscle mass, you can not only cure type 2 diabetes, you can prevent it, and if you have it, you can make your sugar a lot better controlled using a lot less medicine and have a lot less complication. We know now from American Heart Association that muscle building exercises are a part of also people who have heart attacks. So you can actually do this to prevent heart disease.
So there are things you can do once you find out you have a diagnosis of diabetes. Let's talk about some of those signs and symptoms that may give our viewers a hint they may have diabetes. What does it show up like?
Unfortunately, diabetes doesn't have a lot of symptoms. If you have very high sugar, the symptoms come only late in diabetes. When your sugar are 300 or more, then you are thirsty, you go to the bathroom a lot, you start losing weight, you start having itching, you lazy and tired 2 hours after meals. That's one of the early signs. But the earliest sign that you will get type 2 diabetes is the belly size. You look and say, oh, I'm gaining weight here. I'm having some fat, more fat in this area. Weight gain, especially in the central area, that's the early sign that you are at risk of type 2 diabetes. But in terms of symptoms, it's really rare. This is what happened when your sugar really high, they put a pressure on your kidneys, and now you're going to the bathroom a lot. Unfortunately, it's too late. We want to discover diabetes way early before that so you can prevent it, or you can take care of it, so you can reverse it.
Can it be cured? You said it can be reversed. Can diabetes be cured?
Type 2 diabetes, type 1 diabetes cannot be cured. Once you have that problem, you can, and there's probably 20 different things that have been tried in the last 20 years, nothing worked to reverse it or prevent it. Type 2 diabetes, if you catch it very early in the process and you change your eating habits, you exercise, you build some muscle mass, you can cure diabetes. You can go 10, 15, 20 years without worrying about your sugar. Once you have it advanced, that your sugar now running in the 200 to 300, unfortunately cannot be cured, but again, can be controlled. One of the misconceptions about type 2 diabetes or diabetes, people think that it's a death sentence. Oh, I got diabetes. Oh my God, I'm done for the rest of my life. You can control your diabetes. I saw a patient who had diabetes for 75 years. Her sugar was perfectly controlled. Her eyes are perfect. Her kidneys are perfect. Her feet are perfect. That's not the norm. We usually see people like give up on diabetes and they start getting the complications in their eye and their kidneys and the nerves and the heart, and they say, well, nothing you can do about it. That's absolutely wrong. Once you have it, if you behave, if you listen to your doctor, take the medicine, exercise, eat right, you can prevent all the complications. All what it comes is a number. You have diabetes, but if it's not causing any complications, you'll have beautiful, normal life.
I'm so glad to hear you say you can have a beautiful, normal life. Coming up in our show, we're going to talk even more about how to manage diabetes, but I want to thank you, Dr. Opada Alzo-Haley, for being with us today. You're an endocrinologist. You have offices in Dearborn. That makes you an expert on diabetes, and we're so grateful to have you with us today.
Thank you for having me.
When we return, we'll talk with a podiatrist about diabetes-related issues and the feet. Stay with us.
I run, I play, I test 5 times a day. I'm constantly asked, what is your number? Each time hoping it's right. I'm awakened by finger pricks in the middle of the night. It wasn't even my fault. Genetics, virus, or some unknown cause. I feel a cure is near. I can almost hear the applause. My life is otherwise normal thanks to the support of research, family, and friends. Join our efforts with your support. It's time for diabetes to end.
Please, help us stop diabetes.
Clean kitchen surfaces, utensils, and hands with soapy water. 1 in 6 Americans will get sick from food poisoning this year. Keep your family safer. Check your steps at foodsafety.gov.